Human Metapneumovirus or hMPV is a common respiratory virus. It spreads through respiratory droplets which are released when an infected person coughs or sneezes. hMPV often presents with mild, cold-like symptoms. These can include a runny nose, cough, sore throat, and fever. hMPV is a seasonal virus, typically circulating during the winter months. This coincides with the flu season. Most people recover from hMPV without complications. However, it can pose a greater risk to vulnerable populations. These vulnerable groups include infants, young children, the elderly, and individuals with weakened immune systems. In these individuals, hMPV can lead to more serious respiratory illnesses, such as bronchiolitis or pneumonia. There is currently no vaccine available for hMPV. Treatment focuses on managing symptoms. This may include over-the-counter medications to reduce fever and relieve congestion. Prevention strategies include frequent hand washing, covering coughs and sneezes, and avoiding close contact with sick individuals. Recent reports indicate a surge in hMPV cases in China. This has caused concern among some. However, it is important to understand the context of this increase. China, like many other parts of the world, experiences a rise in respiratory illnesses during the winter months. This is due to a combination of factors. Colder temperatures favor virus survival and transmission. People tend to spend more time indoors, increasing the likelihood of close contact. Additionally, decreased sunlight exposure can weaken the immune system. The increase in hMPV cases coincides with a rise in other respiratory viruses in China. This includes influenza and respiratory syncytial virus, or RSV. This suggests a broader pattern of seasonal respiratory illness rather than an isolated hMPV outbreak. It is also worth noting that China's surveillance and testing capabilities have improved significantly in recent years. This could contribute to a higher detection rate of hMPV cases compared to previous years. Global health experts have been monitoring the situation in China closely. Their assessment provides valuable insights. The World Health Organization, or WHO, has stated that the rise in hMPV cases is not unexpected. They emphasize that hMPV is a known virus with established seasonal patterns. The European Centre for Disease Prevention and Control, or ECDC, has echoed this sentiment. They have been tracking hMPV activity across Europe. Their data indicate that current levels are within the expected range for this time of year. This suggests that the situation in China is not unique or particularly alarming. Experts stress the importance of remaining calm and following recommended public health measures. They advise against unnecessary travel restrictions or trade limitations. These measures are unlikely to be effective in controlling the spread of a respiratory virus like hMPV. Section 4. Seasonal Trends and Comparisons. To understand the significance of the hMPV surge in China, it is crucial to examine seasonal trends in other parts of the world. The Northern Hemisphere typically experiences a peak in respiratory virus activity during the winter months. This includes hMPV, influenza, and RSV. Surveillance data from countries like the United Kingdom and those in the European Union and European Economic Area reveal a similar pattern. hMPV levels are currently within the expected range for this time of year. This underscores the cyclical nature of these viruses and the importance of interpreting data within a broader context. The increase in hMPV cases in China aligns with these global trends. It does not appear to be an isolated event or a sign of a new, more dangerous strain of the virus. Public health officials worldwide continue to monitor the situation closely. They are prepared to adjust their response if necessary. Section 5. Public health measures and reassurance. While the rise in hMPV cases in China may seem concerning, it is essential to remember that this is a well-known virus with a predictable seasonal pattern. The situation is not unprecedented and does not warrant panic. Public health authorities in China and globally are well equipped to handle the situation. They are actively monitoring the spread of the virus and implementing appropriate measures to mitigate its impact. These measures include strengthening surveillance systems, increasing public awareness, and ensuring adequate healthcare resources are available. Individuals can also play a role in reducing transmission. Simple but effective hygiene practices can make a significant difference. These include washing hands frequently with soap and water for at least 20 seconds, using hand sanitizer when soap and water are not readily available, covering coughs and sneezes with a tissue or the elbow, avoiding close contact with sick individuals, and staying home when feeling unwell. By following these recommendations, individuals can help protect themselves and others from hMPV and other respiratory viruses. It is important to stay informed about the situation and to rely on credible sources of information such as the WHO, local health authorities, and reputable medical professionals. By working together and remaining vigilant, we can navigate this respiratory illness season effectively.